In 1932, residents of Macon County, Alabama, lived their daily lives without knowing they had been enrolled in a federal medical study. The study was conducted in Macon County, where most participants lived near the town of Tuskegee. The study was organized and funded by the U.S. Public Health Service. The stated objective was to document the course of untreated syphilis in adult black men. A total of 600 men were enrolled, including 399 diagnosed with syphilis and 201 without the disease. Participants were recruited through local clinics with promises of medical exams, meals, and burial insurance. Participants were told they were being treated for bad blood, a nonspecific term used locally. They were not informed they had syphilis and were not given curative treatment. The study continued without interruption through the 1930s. By 1947, penicillin had become the standard treatment for syphilis in the United States. Study documents show participants were deliberately excluded from penicillin treatment after 1947. Public Health Service physicians instructed local doctors not to treat enrolled participants. Researchers continued periodic examinations to record symptoms and disease progression. The study remained active for a total of 40 years. Many participants developed cardiovascular, neurological, and systemic complications. Some spouses contracted syphilis, and children were born with congenital syphilis. The study was not publicly disclosed during its operation. In July 1972, the study was reported by the Washington Star and later by the New York Times. Congressional hearings were held following public disclosure. The study was formally terminated by the Department of Health, Education, and Welfare in 1972. Federal investigations concluded the study violated basic ethical standards for human research. In 1974, a class action lawsuit resulted in a $10 million settlement for survivors and families. The National Research Act was passed in 1974, establishing oversight for human subject research. The study is now a required case in medical ethics education. The Tuskegee syphilis study remains one of the most thoroughly documented medical ethics violations in U.S. history. Truth we seek. From the Bird's Peak. Subscribe to make this possible.